Hi everyone. Welcome back to our YouTube channel. Today we will talk about diabetic foot and its orthotic management. First of all, we should know, what is a diabetic foot? A diabetic foot refers to a condition that affects individuals with diabetes, a chronic metabolic disorder characterized by elevated blood sugar levels. Diabetic foot problems arises due to complications associated with diabetes, such as peripheral neuropathy, nerve damage, and reduced blood circulation. These complications can lead to a range of issues, including ulcers, infections, and deformities in the feet. Signs and symptoms of diabetic foot problems can vary, and it's important to be vigilant and seek prompt medical attention if any of the following issues arise. Numbness or tingling, changes in skin color, temperature changes in the foot, swelling in the foot, pain or discomfort, cuts, sores, or ulcers, ingrown toenails, fungal infections, deformities like shark foot. Now let's talk about the orthotic management of diabetic foot. The total contact cast assists in even distribution of forces across the plantar surface of the foot, preventing further destruction of involved bones and joints and eventually limiting the degree of deformity. In-depth shoes are usually blucher-type Oxford shoes that are more deeper than the conventional shoes. This extra space helps when using insole and foot orthoses, which are necessary in cases of foot deformity due to shark or arthropathy. Control ankle motion walker. It is a prefabricated removable walking brace used in the diabetic foot. It controls the ankle movement and uses an arch filler. Pneumatic walker brace. The pneumatic walker applies pneumatic pressure to reduce edema and prevent callus formation. The advantage of the brace: they are easy to wear, making it possible to manage the affected area at a relatively lower cost. The next brace is Charcot Restraint Orthotic Walker, CRO. The Charcot Restraint Orthotic Walker, CRO, is an orthosis manufactured to completely cover the feet and legs and can be applied to diabetic feet with Charcot arthropathy. For a severe rocker sole deformity in the midfoot, it may be necessary to limit or eliminate the movement of the midfoot and hindfoot to restrict the entire foot and ankle joints. This CRO brace will eliminate such movements. These are the braces which can be used in the diabetic foot care. If you like watching this insightful video, please hit the like button, subscribe and do not forget to share this video.